Hi, good afternoon. I'm Dan Sweet with Helicopter Association International, and welcome to HAI at Work webinars. This week, we are getting a little bit more member-specific focus than we normally do, but it's because we have a topic that we think is really important for our HAI members. We have a number of programs that we make available to our members only. And this is one that we know that everybody generally needs, and that's going to be the member health insurance coverage. And this is an overview from LIG. So today, let's jump right into it. We'll talk about our panelists, find the right buttons here. There we go. First person we're going to be speaking with today is Teresa Farmer. She is our Assistant Director of Membership here at HAI. Tim McNichols is the Executive Director for Partnerships with LIG Solutions. And joining him is Nora Clorty, the Account Manager for LIG Solutions as well. If you have not been on our webinars before, they are interactive. We do encourage you to ask questions, especially on a topic like health insurance, because there's a lot of information out there and we know that there's a lot of variables. And so Tim and Nora are willing to talk in some cases about some of your specific situations to a certain degree. We'll see what they can help us with. We do ask that you use the question module for your questions. We know that Zoom has both a question and a chat feature. The chat feature, go ahead and use that if you like, but we're going to pay most attention to the question module just simply because we know that that's going to be our focus. We are making a recording of this webinar. If you want to see this, if you missed something, if you want to share information with somebody else, we will probably try to get the recording up tomorrow. Sometimes it takes as long as Monday before we can get that posted. We are going to be sharing information with a link here, well, right now, and I'll bring this up again towards the end of the webinar. Teresa's offered to share her email address. If you have specific questions about HAI member benefits or the LIG insurance program or just anything related to your membership within HAI, Teresa's the person to talk with about that. She's also made available a one-page handout that has information about our member benefits. And so you can either use the link that's there in light blue, type it all in. Obviously, even on a recording, you're not going to be able to click on it. That's why we did set up a QR code. So I'm going to leave that up for just a second. I will bring this slide back up towards the end of the webinar again. In that case, if you miss it now, grab a pencil and paper a little later on, and you'll be able to see everything. So I'm going to stop sharing for the moment on the screen. And Teresa, why don't you go ahead and bring your camera on up? Nice to see you, Teresa. Thanks for joining us.
Absolutely.
Hey, HAI does have quite a number of member benefits. And so what can you tell us? Why are we talking about health insurance today?
Well, Dan, I think health insurance impacts everyone at some point in their lives. And when you need it, you need it. So with that, I'm going to introduce Tim McNichols and Nora Clorty. They're with LIG Solutions. Tim and Nora, thank you for joining us today and helping our members navigate their way through this new benefit.
Thank you. Thank you for allowing us to be here, Teresa. I really appreciate that. Dan, thank you for all the introductions as well. Take a quick sec to do some introductions. Nora, you want to start?
Absolutely. Hello, everyone. My name is Nora Clorty. I am the account manager here at LIG, so I help facilitate all the information getting to you all.
Wonderful. And my name is Tim McNichols. I'm the Executive Director of Partnerships here at LIG Solutions. I actually work with all our associations, and right now we work with about 120 or so different associations and membership organizations to bring a similar, program to their members. My background includes, actually having worked for associations for a good chunk of my career, as well as being an association partner. So I think that's really, kind of what is unique about what we do here at LIG is that, I took those years of experience and kind of built in a program from the experience or the understanding of a member as opposed to the insurance industry. So I think you'll see a lot of that in what we are going to go over here today with you. And to that, we'll get into a little bit of what we'll cover. So we're going to talk about who is LIG, because this is important, to understand kind of who we are as a company and how we work with you. We're going to look at like, what are your options here right now in 2023? And as we kind of start even thinking about what's happening in 2024, that's all relevant. So if you're, needing coverage now, or you're thinking about coverage options for later on in the year or next year, these are all going to be relevant to you. We will then go into kind of what is the program, what does it, bring, and what does it have for you as a member benefit, and kind of get into some of those and talk about how you access the program. And then of course, we'll wrap it up with a Q&A session. So that is, where we're coming from today, and we'll kind of get into it here with who is LIG Solutions. Well, we are a national insurance broker, and why that's important: as a broker, we work with every insurance company available. We're not beholden to one company. Think of an agent like a State Farm, where they're selling one product typically, and that would be like a State Farm type of a product. Here, with what we're doing as a broker, we partner with really every single carrier. We work in the individual space and also the employer space. As a company, we were founded in 2009, and the idea when the company was founded, right before the ACA or the Affordable Care Act or Obamacare, whatever you want to call that, became a reality, was that people would need help with this new kind of landscape of health insurance. And it's been pretty true. Lots changed since that time frame, a lot more options. And, as I mentioned earlier, or showed you just a moment ago, a lot about what we're going to talk about today is choice. And you actually have choices today, which is unique. And it's good to say that we can offer you choice. We as a company, we're located in Independence, Ohio. The majority of our staff is here in Ohio, but a happy kind of outset of COVID was that we were able to start hiring people from around the country, especially people that had some special skills, bilingual and others. So we've really kind of rounded out the business because of that. When we start looking at what it is that we're offering, health insurance, which you would consider major medical, that's typically an individual product or family product, group in the sense of for an employer or employee group, and then something called short term, which fits into, what is the individual marketplace. We also have Medicare, full offering of both Medicare Advantage and then the Medicare supplemental. The Medicare Advantage is really all the supplemental products packaged in one clean, neat little bundle. And it has a look and feel of a traditional health insurance package, where supplemental is, you've probably heard the terms of like Medicare supplemental product like A, B, D, and others. And that's those types of products. And there's a time and place to use both approaches. And so that's part of what our process here with not just Medicare, but overall, is really kind of understanding the needs that you have. It is really a needs-based or needs analysis that we take with you. And it's really a concierge approach with what we do. And that's really what makes us different. So, we'll get into that in a moment. But the other areas that we're looking at for you are things like what would be a supplemental or ancillary product, dental, vision. We have a non-insurance pharmacy program, life, things like hospitalization, critical illness, some disability products. All of those can be done. Everything we have a la carte. There's no, there's nothing written down anywhere that you have to buy one to get the other. So we have some people that get great coverage through an employer, but don't have for major medical, but don't have, say, a vision or dental plan or something that they don't really like. That could be what you're looking for. We then also have our group offerings, which is something that would be considered employer-sponsored coverage. The two things that we're looking at there are traditional group coverage and something called an ICHRA, which stands for Individual Coverage Health Reimbursement Arrangement. We'll spend a little time talking about those today to give you a better understanding of what those are. But the one thing I do want to point out, and something we can't do, a lot of associations, or at least members from associations have heard this term before, an association health plan. And really what that is a group plan that the association can offer with one specific product that all the members can take advantage of at one set price. And today, unfortunately, that's not an option. There is no national solution for a product like that. There's been some different attempts to bring those back because they used to be a thing, a number of years ago. The past administration had brought one forward. It ended up getting, well, I don't want to say got sued, but there was 13 states that sued to stop those from going forward. And the rationale or the reason for that is because the association health plans were not or do not have a clear mandate to offer coverage like you would through the Affordable Care Act. So the things that were built in or baked into the Affordable Care Act, like covering pre-existing conditions or some of the preventative medicine things, women's health, mammograms, colonoscopies, things along those lines weren't required. Many did, but they weren't required to be part of that coverage. So that's why those are not an option currently. But as an organization right now, we have over 50 licensed insurance agents that work for our VIP teams, which is what we call it internally, but really it's our association members. We work with, as I mentioned earlier, really every carrier in the country. So we're going to be able to look at the coverage that makes sense for you based on where you live at. Not just that, but, also lifestyle, your financial needs, and obviously your health needs. So we will, spend that time to find that out and make sure that we're getting you to the right program. What we do offer is a comprehensive insurance solution. There are many parts to it. And as I mentioned earlier, you can do a la carte, meaning get one and not the others. And as you see in kind of the overview here on this screen of what's underneath the health insurance, which is really that under 65 major medical, Medicare, the ancillary products, the ICHRA and the group plans, these are, kind of the basics of what we're covering. Probably one of the biggest things to point out is geography. We are licensed in all 50 states. We work in all 50 states. There are some limitations based on a few states, really the way they have their insurance set up for typically under 65. If you're looking at individual products, not group or Medicare or anything along those lines, but if you're an individual that needs coverage as an independent contractor, you're not getting coverage through an employer. We have a few states like Massachusetts, Washington State, and a couple others that either limit or restrict a broker from using or selling products in their state. They want their residents to go through the state exchanges, which it's important to bring up. We do use the state or federal exchanges, but we're able to do some things for you that you wouldn't necessarily be able to do on your own, which is part of the exclusivity of this program. We have access to like ACA plans, for example, that you wouldn't be able to get through the exchanges. Access, if you're on a state or federal exchange, you don't have access to any of the ancillary products, so no vision, no dental. Typically, you're not going to be looking or getting group coverage through there or Medicare. You're going to have to go all these different places. So we've pulled it all together into one resource.
Hey, Tim, before you go on,
yeah.
On my end, I don't see the screen.
Oh, really?
Yes.
Okay, let me hit share again. Oh, and it shows from the, would help if I had hit.
There we go. I didn't want to interrupt you, but thank you.
I appreciate that. Thank you. So I'll go back and, just kind of hit the touch points here. Just again, this is what I was talking about with, where we're at as a company and kind of the things that we're offering. So just to give you that idea of that screen we were on, we were now talking about this, where you see along the bottom, what we were talking about with the different aspects that you see are the major points underneath things like health insurance, Medicare, the ancillary products, ICHRA, and the group. Again, when we start looking at the segmentation on a geography standpoint, Medicare, we can do it in every state, no issues, because it's a federal program. The group elements, both the ICHRA and the traditional group health plans, can be done in every state. Most states, we can do the individual ancillary products in. Group, we can do in all 50 states. It's when we get into the individual under 65 products where some states, like I said, Massachusetts and Washington State, as examples, restrict those, but we will be able to guide you and point you in the right direction on what you can do in those states. And it's really because the way they have it set up, each state rules or at least governs their health insurance on the under 65 side of things. So rates are set with the state regulatory boards by the carriers. One thing that you may have heard from other brokers maybe at some point is that they can get discounts, things along those lines. I'm here to say that there are no discounts in the major medical health policies. Those rates are set with the or state regulatory groups, or Medicare is set with the federal government. And as such, there isn't discounting. If somebody is telling you they're discounting, they're probably moving you to a different plan. Might be the same basic plan, or at least the same basic structure, but something's changed. The prescription drug coverage has changed. The out-of-pocket expenses have changed. Something changed, and it's not the exact same plan. And so what we're going to be able to do is go through and look at all those options for you, find the most affordable ones that are based on some of those things that we discussed about that, on that needs analysis, what makes sense for you based on where you're at in your life today or where you're headed. So again, having said this, choice is something that we're going to spend a lot of time, or at least you'll hear me mention a few times today. So we're going to get into like, what are your options today if you're looking for coverage as an individual or a family or a business owner. So we're going to hit on these, quickly, just to give you that flavor of what's real coverage that isn't, there's things out there like health sharing accounts, which really aren't insurance. It's where people like share the cost of their of health expenses. They're usually out of a religious organization or something along those lines. We don't offer those. That's just, it's not insurance. But what we're going to start first is with what you would call either Obamacare or ACA coverage. This is a plan if somebody is an individual that you're typically going to look at first. One of the reasons for it is that it's obviously real insurance, but it has a lot of the elements baked into it for like you do not get charged more for pre-existing conditions. You will not be charged more if you get sick while you're on it and you're renewing later on. Prices will stay consistent outside of maybe some price increases from year to year, but those are usually very manageable. Typically, if you've had what they call a qualifying life event, you're going to have access to an ACA plan at any time of the year with a QLE. QLEs are things like birth, death, marriage, divorce, adopting a child, job change, a few other things. One of the things that happens or has been happening a lot out there, with different companies and different industries seeing layoffs, those people, typically are offered, say, something like COBRA, which we'll talk about in a minute. There are alternatives. So we'll spend a little time talking about that. But with these plans, these are things that, a lot of people will look at first. In the past, there were people that thought that they couldn't afford it because they didn't qualify for subsidies. We'll talk about that in a moment as well, but that's changed. So that's something that for a lot of people, if you've looked at it in the past, you may now qualify for subsidies that you didn't before. We'll get into that in a moment. But the idea is that this is usually one of the most reliable types of coverage that you can get, but it isn't the only type of coverage that you can get. A lot of it is based on, not just where you live at, but how many people in your family are going to be covered, and things like your age, and then even your financial situation. And that applies to that subsidy, which is really a tax credit that you could get. We'll again spend a minute on that here in a moment. Another individual option that's still available is something called a short-term option. These are an alternative to ACA coverage options. That short-term, that name is slightly misleading, at least today. But the idea of short-term is that they can be purchased for a short period of time. Typically right now it is 3, 6, 9, and 12 months. There is something happening within the federal government where they're, I don't want to say toying with, but they're looking at making a move where they're going to have these be only available for 3 months going forward. But for right now, and if you have one of these plans, you'll be grandfathered in from what we're hearing. But the idea is that you can have these if you're relatively healthy, don't have any pre-existing conditions. These can be a very cost-effective option for you. They are medically underwritten. So if you've had something happen, you've had cancer, a heart attack, you have diabetes, some other ongoing medical conditions, these would not be plans that we would offer. That's again in that needs analysis that we would do. We would talk about your health situation. And the reason for that is really for these types of plans. If these are not an option, we're not even going to bring them up to you. These plans right now, you can purchase at any time of the year, so you don't need a QLE. The only thing that I really would look at as quote unquote bad with these is that pre-existing condition component, and that's really just because they are limiting their exposure and not allowing them. Now in many cases you can still get the coverage, you just wouldn't be covered for that pre-existing condition. But again, why we don't normally bring those up when that is in the situation. We have another alternative, well, it's not even alternative, we have a newer option for individuals and actually for businesses as well. This is something that's going to apply to people that are traveling internationally. This is not travel insurance, so don't think of it as I'm going on a 2-week trip to Europe for a riverboat cruise. This is something that's designed for individuals that are spending a significant amount of time outside of their home country. If you're doing that for work, if you're doing that for education, you're a retiree and you spend half the year in the United States, half the year in Canada, there's many different scenarios that this comes into play. But the idea here is that it's a global health insurance program. The one option that we're using right now is through Cigna. It's set up to be available in over 200 countries. They have actually 1.65 million providers that they have set up right now for direct pay. In most cases, they're going to, bill or, work with whatever your provider, depending on the country that you're in directly. If it's a scenario where you have to pay out of pocket, they will reimburse, but it's comprehensive medical insurance. If you are a U.S. citizen and you're traveling abroad, and you spend majority of the time outside the United States, but still have a home address, it's the type of program that you would want to look at. It does cover all ages, so it is something that would work for people that are of Medicare age. If you're a foreign citizen coming in the United States and you don't qualify for Medicare and you're going to still have a home, like an address outside the United States, but you're staying here to visit family, friends, or something, like that, this is a plan that you can get that isn't going to be restrictive based on age. They do have a provision in this as well, and it's partly how it's administrated. But if you're living in the UK, Hong Kong, Cyprus, Malta, Greece, Romania, or Singapore, they do offer local coverage. And what that means is if you are a resident of the UK, you can get this and have this as private insurance that would be independent of what you would have through the National Health Service. And I know a thing now in the UK where a lot of people are because of the time constraints or requirements to get care at times, they're looking to go to private practice or to practitioners who accept private insurance. So this product in those countries would work in that scenario. Outside of that, it requires you to actually be in another country outside of your home country to use it. If you do travel back to the US, for example, and you don't have health coverage here, you do have a time, I think it's a 2-month time frame where you can actually access that health coverage and cover you in the United States. That works for someone, especially if they're traveling abroad. If you work for a company and you do spend most of the time abroad and you're not going to be part of their group policy, this would be again that alternative for you. The nice thing about it is they do have it as a comprehensive plan as well. So you have that international health plan, which is that major medical. They do have options for vision and dental, telemedicine. Probably the big thing is their customer service, which is bilingual and it's available 24/7, regardless of where you're at. You can access it via phone, email, web chat, and they have a smartphone application. So it is very comprehensive, and it is something that our team can go over and work with you on if that is a scenario that fits for you. The last thing that we're going to talk about as far as individual coverage is Medicare. Now, I put up 2 elements on here, Medicare and Medicaid. I did call that out because they are 2 different things. And sometimes people do, they'll try to use the words interchangeably, and they are very different. So I wanted to point that out. Medicare is meant for individuals that are 65 and over. Even if you're on traditional group health sponsor or health plans through your employer, there are things that you still need to do to get into the Medicare system when you turn 65, even if you plan to continue to have your employer sponsored plan. In many cases, people find out that the plans and coverage they can get through Medicare is probably better than their employer plan, but that's something that you can, talk to one of our licensed agents about to figure out, what's the best scenario for you. Again, these benefits are for those that are turning 65 or 65 and over. And you have really 2 ways that you can go with these types of plans, where you do the Medicare supplemental approach or Medicare Advantage. Medicare Advantage is more like an HMO. Usually, if you're not traveling and you don't get away from home too often, other than vacation, this is the plan because you're going to be required to see your doctor in your home area, like for physicals or any, type of non-emergency situations. The Medicare supplemental plans, those are what you would think of as more of a PPO, point of service. Those you can usually get coverage or, see a doctor or a specialist anywhere in the country. One of the carriers that we work with, they have something called the passport. And so we have a lot of people that travel within the United States a lot. They spend, 6 months here, 3 months there. In that scenario, if they're using that option for that from that carrier, they actually go into the website or make a phone call, and they now let that carrier know that for now I'm here in this location, and that becomes your home base. So that's how they end up working those kind of things. We can and should, tell you that, there are a lot of intricacies within Medicare. We have a fully licensed team of Medicare agents and experts. If you do have, coverages, you want to even just make sure that you have the right coverage right now. We encourage you to talk to them. They're going to be able to go through, if you're on the best possible plan, nothing that we ever do, either with Medicare or under 65 or our group, we're not going to move you into a plan just for the sake of moving you into a plan. We're here as a trusted advisor. We're here to, let you know what your options are. If it is the right scenario and you need health coverage, obviously we can get that for you, but we're not in the business of just making a switch and putting into something to put you into something. That's not what we do or why we do what we do. I do want to point out the idea of Medicaid. There's two things that are relevant here. One is that it's different than Medicare. Medicaid is typically a low cost or no cost health insurance for people that need it, need help from a financial standpoint. That usually is financial and like family size. It's, meant for a low income, people, family, pregnant women, elderly. You can, as a person that's over the age of 65, depending on your financial and health and some other elements, combine Medicaid with Medicare. Because there are costs obviously associated with Medicare, but depending on somebody's scenario, they could actually get Medicaid to work in conjunction with Medicare, but also people with disabilities. The big thing here is that we don't work with Medicaid. That's usually it's a federal program, but it's administered by the state. If we find that we're talking to someone that is Medicaid eligible, we're going to point them to the right resources within the state that they live in. The one thing, though, that we are finding is that there's something happening right now. The federal government during COVID had actually kind of upped the game a little bit with Medicaid, as people were finding that, they weren't able to work, or, their industry was impacted by, anything that was happening with COVID. So a lot of people did get into Medicaid over the last 3 years with the pandemic. But as the pandemic has wound down, they've now taken the health emergency away. They've also stopped the expanded funding of Medicaid. So the states now are going through a what they call unwinding. So you may find, if you own a business, that you have some employees who, for whatever reason, may have qualified for Medicaid. No issues, no judging ever there. But now they are being unwound or being really removed from the program. So you may find that they're going to ask you about, how can I access an employer plan, or if there are employer plans available. We have a lot of experience in helping those individuals get from what they were doing within Medicaid over to plans, either through an employer or an individual basis, that make sense and can help them. And most people that are being removed are people that are back to work, and it really is income based. They're now making the salary that can cover that. Now we're going to talk a bit about the employer coverage, which we'll spend a little more time talking about that a little bit later. But really, we have two options that we look at for our members who are business owners. The first is traditional group health insurance, and the other is this ICHRA, or it's an HRA. HRA stands for Health Reimbursement Arrangement. ICHRA and QSERA are the two versions that we typically use. The QSERA is a qualified small employer HRA. The ICHRA is the individual coverage HRA. It's a way for the big difference between an ICHRA and a traditional group plan, where with a group plan, you as a company, pick Blue Cross, for example, and that's the coverage that all your employees get. They have the same basic health plan. You're open to each year rate increases, and they're usually group rated. So if one employee gets sick, it could impact the rates that everybody else is going to have to do the next plan year. Those types of things aren't available or don't happen in the ICHRA market or the HRA market. There isn't an insurance picked at the top any longer. We'll spend a little bit more time talking about that in a few of the slides, but that's one of the biggest differences of how the insurance is done. And the commonality between the two is really about the financial side of it, where a business is going to pay for a portion of the insurance for their employees, and the employee has a responsibility. That's basically the same between the two programs. There are some other differences which we'll get into, but the HRA allows a business to offer pre-tax money to their employees to purchase individual health plans. And that's the other big difference, where it's still a group plan, but the employees are actually using ACA compliant health plans. And so we set that all up. It allows for a lot of cost control for the business, and quite honestly, the word I keep coming back to, choice for the employees. Think of it in this sense that, if you have all your employees, or everybody that's on this presentation now, if you have everybody say, what is your auto insurance or your homeowner's insurance or rental insurance, whatever, you're going to be hard pressed to find somebody that has the exact same plan as you. The reason being is they're picking a plan that works for their scenario, for what it is that they have, the kind of cars they have, how much they drive, where they live at, all those factors come into play. And people pick it because they can. They don't have, it's not through their business. Here, you cannot have best of both worlds with an ICHRA model, where the employee can pick a plan that makes the most sense for them, but also have their employer still help pay for a portion of it. Kind of the best of both worlds in that way. No issues with the traditional group plans. It's just, I think everybody kind of understands, or at least knows what that looks like compared to the ICHRA. And again, we can answer any questions for you on that as we get into some of the other slides. We're going to kind of wrap it up with what your choices are right now with the other health coverage options. And this really is that supplemental or the ancillary products we were talking about before. Just to be clear, if you have teeth cleaning or eye exams, or you need bridge work done, or you've, some other issues where you need to get glasses and some testing and things along those lines, that usually is not included. Well, it's not included typically in your major medical plan that you have. That's why people get separate dental and vision plans. This, again, just like regular insurance, health insurance, it's meant to keep you safe and also to protect you financially, so that they are covering a portion of it, making it affordable and making it so you're not having to dig deep. They're pretty affordable plans to begin with. But the idea of something like vision, dental, life insurance, critical illness, hospitalization, these are all the plans for under 65 that you're typically going to look at, in addition to a major medical plan. And we can talk through how those look for you and why you would look at getting something like that. But the idea of these being available for those that are under 65, plus there are similar type programs for Medicare individuals. A lot of Medicare supplemental plans now are getting put into or part of those Medicare Advantage plans. A lot of those are now including dental plans and some other elements too. So things have changed a lot over the last couple of years. But this is, again, where I would tell you to talk to one of our licensed agents, and they can kind of go through the details with you. We also similarly have not just individual options, but we have group options for these same types of programs, vision, dental, and so on. So depending on the scenario where you're at, we can look at all these different options for you. I mentioned I was going to get into just a quick explanation of what's changed with subsidies and why that, back to that ACA slide. In the past, people that had looked at ACA plans might have found that they made too much money based on, their size of their family, the income that they had. But as people, really started to be impacted by the COVID pandemic over the last few years, the government realized that that was actually something that wasn't good. People needed help, especially as people, there were still people that, had a decent income, but couldn't qualify for Medicaid. So the changes were made to the way subsidies were done. In the past, people would look at it as kind of a cliff. You would get to a certain point, made too much money, and it was just a straight cliff right down, and you didn't qualify. Now it's more of a gradual downhill. People, again, that didn't qualify in the past will qualify now, and it's more of a slope down, gentle downhill slope. There is a certain level where you hit it and you make too much money, you don't qualify for a subsidy. But in essence, a subsidy is a tax credit that you take either at the beginning each month when you pay for your health insurance, or you take it at the end of the year when you do your taxes, if you qualify for any of those subsidies. So the government's found that, with the ACA plans, that the subsidies can really help and benefit a lot of people to help make the health insurance affordable and figure out how that can work. So the subsidies that are in place right now, it'll actually go through to the way it's set up today through 2025. They had originally been done through the end of 2023. I'm sorry, end of 2022, and they extended it so it had for 2023, 2024, and 2025. So for at least the next 3 years, we see, the subsidies staying where they're at, and we feel, at some point it works, and it's proven that it works. They'll probably make that permanent, but we'll see what happens when it happens. Another thing is that, the subsidies themselves, they lower the cost for things like a bronze, a silver plan, but subsidies don't apply to things like Medicaid or the CHIP or an employer plan. You can't double dip, so you can't get both a subsidy and get an employer plan or even that ICHRA plan. Something else that's changed was in the Inflation Reduction Act, there was legislation put into that, or rules put into that helped lower prescription costs. Majority of those were related to Medicare, but we're seeing a lot of that trickle into the market for the under 65 set. And so for Medicare, they actually locked it in, and you may have heard this on the news at some point, but things like insulin for those that are diabetic, people were going without, or they were traveling to Canada. They've locked it in, and I think it's $35 is what I think Medicare has it at now for a vial. I can say that we have a non-prescription or non-insurance pharmacy program. Every day cost for a vial of insulin is actually $29. So it's like a prescription or a subscription plan. We can talk a little bit about that here in a minute as well. But the idea is that there are alternatives out there. Something else that was eliminated was something called the family glitch. And this is where an employer would offer insurance to an employee, but not to their family. And what would happen there is that the family was deemed to have an affordable health plan, because the employer was giving the family, meaning the one individual, the employee, an affordable health plan. The way the rule had been written or the way the legislation had been written, it didn't exclude the family from that. And so what was happening, the letter of the law, as it were, would exclude the family from being able to get subsidized health insurance through the exchanges, through the ACA, Obamacare. And so that's changed. And so somebody that, is getting coverage through their employer, through a traditional group plan, will now be able to, help their family members that weren't covered by that look at coverage. And if they qualify for the subsidies, they're able to get that as well. So that's kind of an overview on, what's available to you today. We're going to kind of go over a little quickly from a timing standpoint, what are the elements of this LIG Association Health Program? A lot of it we've covered already, but just to kind of give you an idea of where this is at. This is open to all current members. If you're joining us as a member of the HAI, you've probably received a number of emails over time and know that you can, access the program through the links that are in those emails or through your members only area. And we encourage you to, do that. And we can talk more about that. If you're not a member, good time to join if you want to access a program like this. And I know the team here at HAI can help you do that if you are so inclined. Just to, again, really stress, this is real insurance. It's not a discount plan or limited networks. For individuals, and families, there's no extra cost. There's no fees to you for using this program. We are, to be honest with you, the way we get reimbursed is by the insurance that we sell. We are getting a commission from the insurance products. But again, I want to point out that as a broker, we are not beholden to any one carrier. We are not pushing any one carrier over another. We are looking at what is the best solution for you. And if you are already in the best possible solution, we will let you know that. And we are not going to put you in a plan just to put you in a plan. So please know that that is, really at the core of what we do. You do have access to year-round coverage. You just may be limited on the type or what it is that's available based on your situation. If you don't have that qualifying life event, and you want an ACA plan, you're going to have to wait till the end of the year to get in through open enrollment. And, if one of the short-term options is available to you, you qualify from the medical standpoint, things along those lines. Those are things that we can get in there. The plans, at the end of the day, they're not customized, but they are designed to match your health and financial needs. Most individuals in the market are going to have 100 to 125 plans available to them. We're going to look at all those options and we do that needs analysis with you. We're going to be able to pare it down very quickly to the 2 or 3 that make the most sense based on your financial health, your health, your lifestyle, and even things like your doctors and prescription drugs and your hospitals that you want to be in network. We'll go through all that with you and verify that those are included in the plans, which is one of the biggest things that we do to get it down to those, 2 or 3 manageable plans that we would be looking at with you. We do partner with a couple different organizations internally here to help make what we do better. One is obviously we work with every carrier that's in the marketplace. So that's probably the first, outside element that you would be dealing with or understanding that you would be working with, because we, again, as a broker, are selling the insurance products from other carriers. If we are doing a group plan for you, we usually have a TPA involved. They are groups benefits management group. Those are all, part of the process. They work with us and for us. So, you are, making sure that you get what you need as far as the program administration, all the compliance elements, tax elements that come into that with offering a group health plan to employers or to employees by employers. So that's, kind of the approach that we end up taking. If you have any questions on that, we're very happy to talk to you about that. Again, choice. We've talked about this a few times. We're compliant across all 50 states. As I've kind of said a few times, this is really a concierge approach. You're going to work with one of our team members, our W-2 employees, and coverage can start with one individual and go to unlimited lives. We're in the process of talking to a company that has 5,000 employees. We have the ability to handle that stuff internally and be able to work with that company to get that coverage. When we start looking at choices of member benefit, that choice of the type of plans that you're looking for, major medical, short-term Medicare, those all come into play on how we do this. Plans, again, are based on those factors when we do that needs analysis of you and your family's health status, your financial situation, where you live at, your ages. Age is important because insurance, especially in the individual market, will cost different or have different costs based on age. It's just a reality of it. And that's something that we'll take into account when we're doing this. And then things like travel, especially if you're in Medicare, if you travel, spend half the year somewhere else in the country, or with our new global insurance, that obviously comes into play as well. we're here to make getting a health insurance a great experience. This isn't something that most people wake up in the morning and go, I'm looking forward to talking about health insurance. Our team does. This is what we do day in and day out, but we're here when you need it. We're not Chick-fil-A. We're not that cool, opening up a new store and people are lining up overnight to get a year's worth of free chicken when they open a new store. We're not that cool. We're not that sexy, but at the same time, this program is here. It's available for you. And one of the things I do want to point out, if you do contact us, you form fill with us, you call us, we do not do anything with your information other than reach out to you in relation to the inquiry that you made. You want to get a quote, you want to talk to one of our agents. We don't sell your information. We don't get it out to another vendor. It stays within the LIG universe, as it were, and you're only going to get contacted about the insurance products that you were looking to get a quote on. I want to stress that we aren't a list broker. We're not selling it. We're not farming it out to others. It's all internal. This is what we do day in and day out with our teams. We'll spend just a couple minutes here just kind of reiterating some of the business elements here. But when we start working with you, if you are a business owner, you need or are looking to make changes or start offering maybe for the first time health insurance for your employees, we will, have a quick conversation with you. Usually is about 30 minutes to just kind of get the lay of the land with you. If you've offered something already, if you're looking to do it for the first time, understand kind of what drives, the need for it. If you're under 50 employees and it's really about retention and bringing in or keeping employees, understand your budgets, because that's definitely going to be a part of this. We can look at the right solution if it's group, if it's the ICRA, even the QSERA. There is some differences between the ICRA and the QSERAs. Really, it's that qualified small employer. It's meant for businesses of under 50. You can't use it for anything bigger. But I find that in most cases, the ICRA is going to work for everything that we can do within QSERA. We can do an ICRA and then some. So there aren't any limitations. In with the QSERA, there's a limit on how much money you can make available to your employees through the program. There are no limits within the ICRA. Again, when we sit down and go through this with you, we can, really get an understanding of what is that makes the most sense and make some recommendations. Some of the benefits at the end of the day, especially with the employer component to this, is that the coverages that you have, it's tax deductible to the employer, it's tax-free to the employee. The money that's available either through a group plan or through ICRA, the employer controls it, but the employee has choice, especially when we're talking about the HRAs. This across the board group, traditional group, and then the ICRA especially, it has the same look and feel as a traditional group plan. It's just that we do things a little bit differently. As I mentioned, the insurance is done at the back end. The employee is picking a plan. We're working with them to do that, but they're picking a plan that fits their needs as opposed to a one-size-fits-all approach, which is what the traditional group plan, where everybody has a Blue Cross plan. Here, if you have 10 employees or 50 employees or 5,000 employees, everybody can have a different plan based on where they live at, not where the business is located at, which really is beneficial. We can do a lot more segmentation in with the ICRA model than we can. So we can, look at it by age, by salary versus hourly, where the employees live at, and really fine tune it and make it so that the financial side of it, really you have that control and more so than you ever would with a traditional group plan. So, again, kind of finalizing this idea of choice as a member benefit. Again, no cost to, talk to us. There's no obligation, no high pressure sales. If you are looking to talk to us, you want to get a quote, you're not going to feel like you have to buy something that day. Coverage for individuals and families, for business owners and their employees. The way you typically are going to access this program, obviously, if you're a member, you've gotten different communications through HAI. Emails, you have the members only area. I know they showed you the new member benefits page. All those things I'm sure have that access point to a landing page that LIG has created, a web page for your organization. It's unique to your organization. There's usually a form on there where you can fill out to request more information and then go to the next level, which is scheduling an appointment with an agent. We're going to ask you for basic contact information, your first and last name, the city and state where you live at. We don't ask for or look for your mailing address, your street address at the beginning, but we do need phone number and email. And we're going to have you tell us kind of what you're looking for. If you look at the box here, it's coverage that's going to be for you and your family, Medicare, if you're a sole proprietor, a 1099 independent contractor, or if you're looking for coverage for your W-2 employees. That's going to help get it to the right person internally within our teams. And again, that's usually going to be based on the state you live in. We also have a, best thing to call is an 800 number. We obviously have many more than just straight old 800 numbers nowadays, 855, 866. They're all those toll-free numbers. But again, I might be dating myself by even saying that. But the idea is that there are many different ways for you to get in contact with us. And we look forward to being able to talk to you. And again, just stress that we don't do anything with your information. It doesn't leave LIG, and it's only going to be used to contact you related to this program. And with that, I can actually stop talking. I've talked a lot. If you do have questions, and you'd like to get more information, if you are a member, or if you're not a member and you just want to get a better understanding of what's in the program more than so today, you can reach out to me. That is my office number, 216-487-6152. And you can email me at tmcnichols, which is my first initial last name. It's TMCNICHOLS @ligsolutions.com. And with that, I will stop sharing and get it back to Teresa, I believe.
Thank you for that information, Tim and Nora. I love that you broke it down for us and made it easier for us to understand. And thanks for joining us today. And to our audience, we wanted you to know that HAI is listening and constantly finding ways to improve the value of your membership. We appreciate your investment and are always striving to find ways to help our members alleviate their pain points. Over the past 18 months, we've rolled out 13 new member benefits that you can take advantage of today. Learn more about all the benefits available to HI members by visiting www.rotor.org/benefits. And if you're not yet an HI member, why not? Just head over to rotor.org/join and become an HI member today. Back to you, Dan.
Thanks, Teresa. We do have a couple questions wanted to run past you, Tim.
Please.
Some of these you might have addressed already. You gave a lot of great information, but sometimes it goes so quick that you don't always get a chance to hear an answer. Let's see, if I run a business or work in employee benefits and I need to implement a new policy, how long does it normally take before a group policy will take effect? And do some options take longer than others?
Well, yes. I mean, there are some things, if you're coming off a traditional group plan, it's going to be really dependent on what your renewal date is. And we want to get ahead of that. So most people start looking 3 to 4 months out from their renewal date. And, we'd like to try to stay within your typical renewal period. If it's a traditional group plan and you're moving from one to another. If it's an ICRA and we go that model, which we are doing that a lot, we're seeing, for a lot of reasons, people are seeing like 30-40% rate increases. And the ICRA is a great option because that just doesn't happen in that model. But we have in there a 90-day requirement, and it's an employee notification requirement. That's actually because the ICRAs are administered or at least overseen by what they call the tri-agencies, which are Department of Labor, IRS, and CMS, which is the Center for Medicaid and Medicare Services. The rule that's in there is that we have to give a 90-day notification to the employees. And part of that too is if you have anyone that's Medicare eligible, for example, in that time frame, we need to work with them to make sure that they have gone in and gotten everything they need done with Medicare, so that when that 90 days is up, we typically are going to start a plan on the first of a month. So if we're looking for a January 1 start date, we'd want to have all that done starting 90 days or sometimes even more in advance, where we'll actually start enrolling in the employees in health insurance sometime in early January, so that it all starts on January 1. I hope that answers the question, but
I think so. How about for an individual? Now, I know we have a lot of people maybe who are seasonal pilots. They've just finished up their flight training. They're wanting to get into the industry. They don't have health insurance at all right now. They're not working for a company. How quickly could you get them into a policy where they would have coverage?
The simple answer is it's always going to be the first of a month. The slightly more complicated is it depends on what their scenario is. So if they are, just left a job and they're coming to a new job, that's going to be one of those qualifying life events. And that way they can get access to, say, an Affordable Care Act plan, the ACA plans, or we can look at those short-term options. And, either way, if it's even something where they're on a probationary period with their new employer and they need something just to get them from the day they start till maybe their 90-day period, that's where that short term really comes in, because you can get it for 3, 6, 9, 12 months. So it's situational dependent, but coverage will always start for really individual and group on a first of a month normally. Okay.
Speaking of the seasonal pilots, and let's talk about seasoned pilots as well. Can you give any kind of range for the the premiums that somebody might end up paying. You know, if somebody is a brand new pilot or a brand new mechanic, or just somebody who's not insured.
Are you talking about a specific age? Like when you say seasoned, are you talking somebody that's over 65 or under or both?
Well, a little bit of both. Yeah. Is there a way to determine a range on rates? Is this
Yeah, I
something?
mean, there is. I mean, it is situational dependent again, because there isn't a fixed rate. So, you know, it will come into play of someone's age, you know, how old they are. Insurance for somebody in their 20s or 30s is going to be a lot less on the individual market than for I'm in my 50s. So it's going to cost me a little bit more. Who's going to be covered? Is it just that individual, or is family going to be covered as well? So that'll kind of dictate what that's going to be. And then are they getting a bronze plan, silver plan, gold plan, platinum plan? But the range could be from, you know, without subsidies, you know, $300 to $1,200 a month. But that takes into account, you know, somebody that has a family of 4 and, you know, they are living in a major metropolitan area, to somebody who's, you know, younger and maybe 25 or 30, and they're, you know, on their own, and they're, you know, getting a basic bronze plan, you know, and they don't, again, not looking at from a subsidy standpoint. There's some individuals out there, if they qualify from an income standpoint, they're looking at no cost or low cost when they look at the subsidies that they have. And some of those plans can be zero deductible as well. So, you know, again, that's where we have that, or encourage them to talk to one of the licensed agents. When we get into the Medicare range, you know, Advantage plans and even the supplementals, those are typically going to range, you know, $350 to $550 a month. And again, it depends on, you know, if somebody's getting Part A, well, they all have to have Part A, but they're getting Part B plus, you know, drug coverage, which is the norm. If they get any kind of Medigap coverage, or if they're getting like an Advantage plan. But again, that's obviously just a range, not a quote. And it's going to be dependent again on where they live at and what type of plan they pick.
Okay, well, you ran through the precious metals range of plans there. Somebody said, I've heard the phrase Cadillac plan, and I know that it was in the news a while back, both good and bad, about what is a Cadillac plan, and does your program offer that?
Well, yes and no. I mean, a Cadillac plan, that's kind of a term to say, you know, it's a upper level plan. You know, those would be typically like an upper range silver or a gold plan. You know, platinum plan would be more like the Audi or, you know, well, I wouldn't say a BMW outside of Germany. I always laughed when I would go to Germany and there would be, you know, BMWs at the or Mercedes at the airport as taxi cabs. And I'm talking to my friends back in the States who, you know, I just got a new Mercedes. I'm like, yeah, you bought a taxi cab. But at the same time, you know, it meant a higher level plan. And, you know, really just it was, you know, kind of in reference to a lot of the group plans that were out there. But, you know, you're going to see you know, a mid-range, you know, out-of-pocket expense, you know, your deductibles, and, you know, you're going to have that. But for us, it's really going to come down to, like, if you have somebody that's relatively healthy, doesn't go to the doctor very often, and they want just to have insurance that really they're going to avoid bankruptcy if they got into an accident. And again, we're not talking about like work related. So if you're covered by Cobra or not Cobra, workers' comp, you know, obviously a different conversation. But the idea of, you know, somebody getting into an accident, you go snowboarding or you're water skiing or whatever, and you break a leg, a bronze plan, you know what your out-of-pocket expenses are going to be, and you know it's capped at a certain point. That's all you're going to have to pay in that calendar year. But when you start looking at something like a family of 4, you know, husband and wife or spouses and kids get earaches on a regular basis, you know, silver or even the bronze plan may not be your best bet. And you may be better off with a gold plan, because your monthly costs might be more, but your out-of-pocket expenses are going to be a lot less. So those deductibles, and that's where and that's why we ask about their health scenario, to really get an understanding of, you know, where we're going to guide them and what's the best. And, you know, budgets are going to be a big part of that, you know.
Okay. I think I heard you address some. Do you offer supplemental plans?
Yes. Yeah. It depends on what it is that we're talking about. So supplemental plans, typically you're going to refer to either Medicare, where you're getting like the A's, the B's, the C's, D's, that kind of thing. And then you have the supplemental that's going to be outside of major medical. So things like vision and dental, critical illness. You know, we had an individual, a member from one of our associations that was a tennis pro of all things. And, you know, he was teaching tennis, and I kicked myself for not listening to my parents when I was younger, but he was teaching tennis down in Boca, down in Southern Florida. His income was over $1 million a year teaching tennis. Yeah. I had the same, when I first heard that, I had the same reaction as you, Dave. But his big concern, yeah, he needed health insurance, but he was an independent contractor. He didn't have, you know, workers' comp to contend with or anything. So if he got hurt teaching, which would be very possible. You're out in the court, turn your leg the wrong way, whatever. So his bigger concern was he wanted to make sure he had things like the critical illness and the hospitalization and some of the disability kind of plans, because he wanted to be able to maintain his lifestyle, their income, his family, and the protection. So we were able to package that with a major medical plan and come up with something that was affordable, but gave him that peace of mind that if something did happen, he was going to have the covers that would allow him to maintain his income and his lifestyle and things along those lines. So think about it like kind of like Aflac. We've all seen those commercials, and you may or may not understand what that is, but they usually pay lump sums for, if you're injured, that then you can use for really anything. That's your call, but it's to replace the lost income.
Okay, I feel like this is a question of mine, and I feel like I should have asked this off camera before we ever got this whole webinar started. I know we do have international members. Do you offer international contacts or international programs?
Yeah, the global plan that we talked about, that's the first of a couple. We have a couple that we're working on finalizing right now with carriers. But the first one we have on is the Cigna. And to me, it's actually the best of the ones that we are looking at right now. But they offer a plan, and the best way to look at it is if you are working for, a U.S. Bell is still owned by a U.S. company, right? So you work for Bell, but you're spending, half the year or more in Europe or wherever, Africa, and you're in sales or maintenance or whatever it is that you're doing. You're probably going to want to have coverage that is in that country. And a lot of group medical plans that you might have through your employer aren't going to cover you or cover you at the level you need to be, especially for extended periods of time. We had a question earlier. We did another webinar about my credit card has 45 days of health coverage on the credit card. And it's more basic travel insurance. These are more comprehensive. So it's really what you would think of as your US based kind of health plan, but it would cover you in a foreign country. And there's one that we have that's any country you go to. So if you travel a lot, there's another that's really set up for like study abroad. Like if you have a student who is going to do 6 months in Spain, taking culinary art classes or something like that, the more scaled down one would be a more appropriate, probably better cost, because it's, cover in the US when they're still here, and then cover them while they're in that one country that they've picked. So a few different options for that. And, it's really situational dependent there as well.
Okay. I don't know if this question is for you, for one of the insurance companies, for a tax attorney, but the medical savings plans where you can have money taken out of your account to help set aside money to pay for deductibles, to pay for medicine, to pay for other medical supplies or health supplies. Is that something your company offers, or do you have information on that?
We have that available. So typically you're going to have like HSAs or FSAs. Those are the two that you usually see. They can be offered, and they're used in the group environment almost exclusively. Because right now today, most group health plans that you have in a company are considered high deductible. And that's like with the HSA, you have to have a high deductible health plan to utilize one of those, but it's where people can put money into it, use it today. Some people use it as a long-term, approach to retirement, where they're putting money in and they sit on it. And when they get to the point of 65 and over, they're using it to help offset their costs related to Medicare and things along those lines. The one thing that I'll always point out is that in the individual market, there's very few plans that are considered high deductible. There are some, but there are a lot less that are out there. So if we're moving a company from a traditional group plan over to an ICHRA, it's one question that we get a lot, especially if they offer and a lot of their employees take advantage of an HSA. You can keep your HSA. If you don't have a high deductible health plan to connect it to, you can keep it, but you can't put more money into it. And the big difference there in an HSA is that money is yours. Flexible spending accounts, typically that's a use it or lose it in a calendar year approach. And a lot of times your employer is helping you fund that. They can help you on the HSA as well. But usually if you don't use the money in that calendar year for whatever, medical expenses, copays, deductibles, whatever, that will disappear and go away at the end of the year. So there's more nuances to that, but there are, similarities.
Okay, well, hey, I think that wraps up most of the questions. Tim, is there anything, or Nora, is there anything, if there was one thing you want our members to know coming out of today's webinar, what might that be?
I think I mentioned it earlier, we're here for you when you need us. And that's the thing. A lot of people aren't thinking about it. Hey, I don't need any help today, but when they need it, they're looking for that trusted advisor that they can rely on. And that's, what we've really created within this program, and having a partnership with an organization like yours is to be that trusted advisor for your members and helping them find the right coverage, the most affordable coverage, and what is going to be the best solution for them in that situation today, tomorrow, and down the road.
Okay, well, Tim, Nora, Teresa, thank you for joining us this afternoon to explain this. Health insurance is kind of a scary topic sometimes, especially if you need it and you don't have it and you need to get it right away. And so I'm grateful that you guys have come to HAI as a partner to work with us on this program.
Yeah, we really appreciate the partnership, and we really have appreciated all the help and resources that we've gotten working with you and your teams. And, really, we've really enjoyed talking to the members. It's been, a good experience, and we have a lot of, good conversations that have happened, and we hope to have those continue.
Okay, well, thank you so much for taking the time this afternoon. We appreciate it and look forward to working with you all again in the future.
Thank you. And we look forward to hearing. And if anybody has questions, let us know. Appreciate it, everyone. Thank you.
Absolutely.
Speaking of that, I'm going to bring the slide back up where I share Teresa's information, her email, and then the information on the member benefits handout. If you do have questions, you can reach out to Teresa. She can give you Tim and Nora's contact information very quickly and very easily. Thank you again, everybody, and appreciate the time and effort you put into it.
Thank you.
Thank you.
I will, let's see, keep on going here. Next upcoming webinars. 2 weeks from now, we'll be at EAA AirVenture in Oshkosh, Wisconsin. It's just an absolutely amazing air show. And we were going to have a couple of different people come talk with us during the course of the week. And so we're going to bring you an update from Oshkosh on the 27th of July. August 10th, it's something I've teased a long time. It kept getting rescheduled. We're finally going to be holding it. And that's going to be a CEO to CEO webinar with Clyde Woltman of Leonardo USA. It's going to be interesting to find out what Leonardo's got planned for the future. They've got a number of aircraft, a number of projects that are always underway. And so we're going to actually find out right from the head of Leonardo USA on what they've got going on with us. HAI loves to share information. We just had a great webinar, and so there's other sources you can get news from HAI as well. First of them, Rotor Daily. It's a daily news aggregator service that we send out each day, each business day. It's say the top 10 or 15 news stories that affect the rotorcraft or vertical lift industry. We do all the Google searching so you don't have to on the news. And so we send that directly to your inbox. It's subscription based and it's free. We try to get international news in there too. Rotor Magazine is our quarterly publication. It's an award-winning publication, has a lot more in-depth coverage of different stories. It's just a nice thing to leaf through if you've got a little extra time, maybe during a coffee break or while you're waiting for a client to come climb into the helicopter. Both those are available. The information all you have to do is go to rotor.org/subscribe. Again, Rotor Daily is free. Rotor Magazine is free. There is a small fee for international shipping on Rotor Magazine. We will be trying to get a survey to you at the end of this webinar. We would appreciate it if you take just a few minutes to let us know what you think. We'd like to get some feedback on today's topic, plus any suggestions you have for future topics. HAI is a membership organization, so we're always looking for information on how we can better serve you. Things like health insurance, some of our other member benefits did literally come from membership surveys. So please tell us what you think we need to do to help you as an HAI member. The easiest and best way to do that is send Jim Viola, our president and CEO, a message directly. His email address is president@rotor.org. That does conclude our webinar for today. We appreciate that you took time out of your schedule to join us. We know that time is vital anymore, and so we are grateful that you were able to sit in with us. Until 2 weeks from now, we ask that you fly safe, you be safe, and we'll see you again very, very soon.